Now we go to another journal, JNCI, to hear about the experiences about reporting guidelines from that journal. Jeannine, please.
Thank you, Anna. And a big thank you to the organizers and the reviewers of the abstracts. It's really an honor and a pleasure to share this study with you today. So can I get a show of hands? How many of you work on a journal or have submitted to a journal that requires standard reporting guidelines at submission? Okay, I'd say that's maybe half or more. That's great. JNCI, we publish a broad range of oncology studies, and we reject more than 3/4 of the papers before peer review. So we want to make it as easy as possible for authors to submit. We strongly encourage the use of standard reporting guidelines, but we only enforce consort at submission. But we also work with the authors to enforce reporting standards before publication. So my bigger question has been for several years, are standard reporting guidelines useful in the peer review process? And to begin to answer that, I decided to ask if using standard reporting guidelines at submission or to prepare submissions, would that improve the clarity of the presentation for the reviewers in particular? So back in August of 2015, we started asking authors at submission if they use standard reporting guidelines to prepare their submissions and which ones. And in that question, we linked out to the standard reporting guidelines. For some time now, our peer reviewers have been rating manuscripts on adherence to reporting guidelines and clarity of presentation. So that piece was already in place for this study. I then used enterprise analytics reporting and editorial manager to gather the data. For this study, I chose manuscripts that applied, meaning that I didn't include letters to the editor or editorials or commentaries because there really aren't standard reporting guidelines that fit those manuscript types. And I also wanted to be sure that the manuscripts had at least a first decision because I was interested in editorial outcomes. And I wound up choosing about an 18-month period where the numbers of submissions and the editorial decision processes were consistent. I then scored the manuscripts or the reviews depending on the analysis, and so I could compare the mean scores across different categories. And I just wanted to point out that this study design has a big limitation in that it's just a survey. So aside from consort, which was enforced, I did not actually confirm that the authors use the standard reporting guidelines. So first what I wanted to know was how many of our authors are using the standard reporting guidelines and which ones are they using? And so you can see of the 2,209 submissions, 51.8% said that they used a standard reporting guideline, 24% used strobe. And this also shows a nice range of the various standard reporting guidelines that our authors said they use, and it's a great reflection of the types of submissions that we receive. Next, I wanted to know, is there an association between using standard reporting guidelines and editorial outcomes? And the short answer is no. But here you can see the data, and these are also in your abstract book if that's easier to read. You can see the numbers of submissions and percentage broken out by the various editorial decisions, then further broken out by whether or not the authors said that they used standard reporting guidelines. And then in the last column, you can see the mean scores across the different editorial outcomes. In this case, I scored each manuscript. I scored it a yes if the author said that they used standard reporting guidelines and no if they didn't. And you can see that the mean scores are very similar. There was no statistical significant difference between them. So finally, the reviewer's perspective. And here I used all of the reviews that were submitted There were 1,033, I think, off the top of my head. And I scored each review based on the ratings that the reviewers were already using to rate these manuscripts. So the scores here range from not applicable, which was 0, to outstanding at 5. And looking at the 2 questions I was interested in, adherence to reporting guidelines, there was a statistically significant difference between the scores in that the score for the papers that said that they used standard reporting guidelines was 3.1. The ones that didn't say they used them or said that they didn't use them were 2.9. Whereas, which was surprising, the clarity of presentation, the scores were almost identical, both 3.3. So my study answer was negative in that in our workflow in this particular study, using standard reporting guidelines to prepare the submissions did not seem to improve the clarity of the presentation. And so finally, I'd just like to thank several people who were very helpful in the study. Meredith added the submission question with the links out. Amanda and Carmen are the editors on the journal, and they gave me input on the design and the results. Matt and Fiona have been the publishers of the journal, and they've been very supportive of the project. And then finally, Michael at Aries provided training on the editorial manager reporting system. So thank everyone for your attention.
Thank you. Excellent timing. Excellent timing. And now we are open for questions.
Yeah, Mark Helpan again. It's reassuring that people can adhere to the guidelines or to reporting guidelines better and not lose clarity. But obviously it's not surprising that it doesn't increase clarity. And I want to say, not to disparage reporting guidelines too much, but over the years, as they have proliferated, I don't think clarity's gotten better, and I think we may have lost something. I'm too young to be curmudgeonly about this, but in the 1980s, we had a meeting with the editors of pediatric journals and Lincoln Moses, and Lincoln's main point to everybody was, no, you got to tell a story. And if you look at the trials in those days, like the Burlingame trials, the Sackett trial of nurse practitioners, and read how they explained, or how he explained, the decisions he made methodologically along the way, and the things that didn't go right or wrong, or didn't go right, and how they went off track, and when they got off track, how they got back. It's a much better narrative and gives you a much better understanding for what actually happened than taking reporting guidelines and making a checklist. And I think the question, I guess the next question that your talk raises is, is there some cost to using the reporting guidelines? Is there something that needs to be added because they're not improving clarity? I wonder what you think about that.
Well, the results from this study sort of reinforce the fact that we may not need to actually require them, because I don't know that during the peer review process they're making it easier for reviewers and editors to do their job. But there's obviously still a lot of use for the reporting guidelines, maybe at a different place in the process.
Yeah, sorry. I think you've got the use of them, but you've also got how they're viewed by reviewers. And if people conceptualize reporting guidelines as checklists and say, hit this one, make a table, or tell us where those kind of things probably, in my opinion, don't add to clarity. Whereas using them as a checklist, a mental checklist to see, did I think of the things that are important and pull them out, is a very different way of writing. And so I think that, when you're looking at how people look at adherence to the reporting guidelines, are they looking at that as, did they hit every single one of these, or are they looking at it as they reminded themselves using this and then they wrote a clear and interesting, logical write-up of their study. I guess that's what I'm trying to figure out, is where to go with the rate, with the how reviewers look at the use of guidelines.
I don't really know how to answer that. Sorry. That was
Maybe
a good
we need
perspective.
qualitative studies to address this in a way. So we have a question here, then there, and then Drummond.
It seems to me that when these guidelines were written, they were primarily written as guidelines to assist whoever designing a study and reporting that study. They weren't really designed to be a requirement, and I'm just kind of curious about when they have evolved into becoming a requirement. It's not clear to me, are they actually a hard requirement? If you don't utilize them or say that you utilize them, is your manuscript then rejected, or what happens at that point in time? And if that is the case, do you think that's a good idea in view of what you've found?
Right. So in terms of enforcing, requiring them, we do enforce consort. We require consort. So at submission, we will not we will not complete the submission without the consort checklist. So that's what I mean by requiring.
Okay. Question.
Denise Goodman.
Well, we actually we make them submit it with the, right, so that's how we require it.
Denise Goodman from Chicago.
Okay.
It strikes me that reporting guidelines can't make a bad writer good, and if you're already a good writer, it's not going to make you better. Similarly, it's not going to make bad science good. The intent, I think, is to make sure that essential elements of a study are incorporated in the report so that anybody reading the report understands that methodologically certain rigorous standards have been met. And I'm not certain that the conclusion from this study is that guidelines are ineffective. I think there's a couple of other potential interpretations. One is that the ethos of guidelines have become inculcated in science culture so that many of the elements are now de facto incorporated into reports anyways. And so I would be interested if you've thought about the next steps to ensure that guidelines are used for the intent that they were created, which is to make sure that essential data elements permit an appropriate interpretation of the results that are presented.
As I mentioned in my background slide, we do work with authors to enforce reporting guidelines, reporting standards using the reporting guidelines. So that's the step that we choose to implement those.
Thank you. Drummond?
When I was little, I was involved in a study with Karen Olson on publication bias, and had to read through personally 625 clinical trials to get information. We also, as a sideline, added information about whether they used consort in preparing this. And we found, and I had what's called a stopwatch. And putting a stopwatch on the time it took to get our information, which had nothing to do particularly with the items in consort. When they had used consort, it took about 5 minutes to get the 30 pieces of information we wanted. And when they did not use consort, it took about 28 minutes. Now that's huge, and I think it answers Mark's question. Right there. That's it. Wish I'd published that.
Thank you.
Good point, yeah. Okay. Thank you. Okay.